Hi, my name is Brad Bolinsky. I'm here from Lexi-Comp. We're the publishing company that produces the Drug Information Handbook for Dentistry. We're here today to talk to you about assuring medication safety in your dental office. With me today are the two leading experts in dental pharmacology, Dr. Richard Wynn from the University of Maryland Dental School at Baltimore. Also, Dr. Harold Crossley from the University of Maryland Dental School at Baltimore. Dr. Crossley, from your experience, I'm wondering if you could explain to us what you see in today's patient population and the demographic trends that you're seeing and the changes in the past 30 years.
I think today there are 3 or 4 different areas that are the most popular among medications, and especially in the geriatric population. The first area is the area of beta blockers, cardiovascular drugs. The second area is in the area of selective serotonin reuptake inhibitors, such as some of the products, fluoxetine. The third area that's very prevalent and very popular, and that is the area of antihypertensive medications like angiotensin II blockers. As the population gets older and they live longer, one of the reasons these people are living longer is they're taking more medications, and so with more medications we see the potential of greater drug interactions as well.
Sure.
And that's going to be that's one of the problems, and it is one of the biggest liabilities probably in dental office, is the potential drug interactions that can occur.
So, Dr. Wynn, I'm wondering how these medications that Dr. Crossley is referring to are affecting dental treatment today.
One thing our database has done is look at the different dental situations that the medications can be involved in. So we sort of mine the literature and we come up with information describing the effects of medications and how they could interact with the vasoconstrictor that they use in your local anesthetic injections, how medications can affect the oral health. Certain medications can cause gingival hyperplasia, and many medications cause xerostomia. And the other area is that many medications can induce bleeding and gingival bleeding. So I think this database is unique from that aspect, is that we have the dental applications in there.
Okay, thank you.
I think in reference to what Dr. Wynn mentioned, there are several drug references on the market already, and but none of them are as dental specific as the Drug Information Handbook for Dentistry is. And I think that's one of the advantages of our book, is that in each drug that's out there, it'll tell you any dental implications of the medication that the patient's taking.
And today, I think that book has sold now over 450,000 copies.
450,000 copies?
It's being used in every dental school in the United States and Canada. And we feel it's a key component to improving patient care, saving some time, and helping reduce liability in the office. So, Dr. Wynn, I wanted to ask you, with technology today and this laundry list of medications the patients are on, how have you seen a change, and how do you see that to the advantage of the average busy dental practitioner?
The technology has allowed us to instantly get information as we collect it into the database. When the book first started, as Dr. Crossley mentioned 15 years ago, we didn't have the electronic applications, and so we were faced with just waiting year to year to year to get new information in the book, because it came out once a year. But now we're literally can update information every day as new information comes out. For example, brand new pain reliever for dentistry has been approved called tapentadol. And as soon as that was approved by the Food and Drug Administration, we got that into the electronic database. If we didn't have the technology, we'd have to wait an entire year to get that into the print. So the technology has allowed us to really keep current information in the hands of the dentist, updated every day.
And Dr. Wynn, as far as the online program goes, can you explain to me how you see that working when a patient's on 15, 20 different drugs, and the dental alerts aspect and what that does?
The online saves time for the dental practitioner because they can literally punch in the name of all the drugs and medications in the patient's history, or have the assistant or technician punch those in. And that instantly brings up that list of medications, and then they can punch in the medications that they use in office practice, such as any of your pain relievers, your sedatives, your tranquilizers, your corticosteroids, your antibiotics. And within an instant, you hit an analyze function, and it cross-checks the medications the dentists are using to the medications the patient's using to see if there's any interactions, that is, any kind of adverse effect that could occur because of the combination of those two medications. And it occurs within seconds. And then that whole output in terms of descriptions of each medication interaction is rated in terms of a risk factor. Should you change medications? Is there nothing to worry about or whatever? And that can be printed out and placed in the patient's file.
Great.
And you can't do that with the printed edition.
Sure. As well as the dental alerts functionality, just to give you a summary of what those drugs are used for and how they affect dental treatment, pulling out the important key pieces of information from the Drug Handbook for Dentistry and summarizing it for you in a one-page summary of what the patient's taking and how it impacts treatment.
What ordinarily was done in the past is that you put in a drug and the entire monograph came up, and so you had to really search through the dental applications. But this way, with the dental alerts function, you place the name of your drug and punch that in and hit your dental alerts button, and your fields come up. And the fields are, is there any interaction between the local anesthetic vasoconstrictor and that drug? The second field is, are there any effects on dental treatment in terms of the oral cavity and so forth? The third field is, are there any effects on bleeding? Because some drugs can induce gingival bleeding and so forth. And then the fourth field is dental comments. And for example, dental comments utilizes information we gather from mining the literature in terms of anything that is additionally known about the drug that could influence the way the patient is handled.
Okay, great. Thank you very much.
And I think that the other thing is that we've been talking about the dentist, the help of the dentist, but really the database and the electronic version is accessible to the whole dental team. And then the hygienist, the assistant, and the receptionist all can use that database because it's available electronically. So it's really very, very beneficial.